joints in human skeleton, the human body, all the joints from atlanto-occipital joint up to your toes are important. So you have to know, like you are now doing lower limb, now the hip joint. The basic principle of a joint is how much, what is it, a synovial joint or some other forms that will be discussed now. So you have to know the joints because it covers a major, if you look at this joint, wo kya padega? Nahi. If you see, if you are having the examiner asks you in the practicals, he says you have the cervical bones, axis and atlas, these two vertebrae. Now, that your skull is articulating, plus the neck, the vertebra of the cervical region. Joint is a union of two or more skeletal elements, bone or cartilage. Skeletal elements, bone, cartilage. So, joint is a union of two or more skeletal elements, that is bone or cartilage. Chief function of the joint is determined by the type of tissue of which joint is constructed. Chief function of joint is determined by type of tissue of which joint is constructed. Now, in great majority of free articular surface slide, spin or roll over one another, there being no other tissue interposed between them. Movement in such joints is facilitated by lubricant called synovial fluid called synovial joints, diarthrosis. Now, it can be an MCQ, diarthrosis. Okay. Now, so it has to be having two bones, bony surfaces. The synovial fluid is there, and also as a lubricant, and no other tissue is interposed between them. Differential growth, transmission of forces, compression, shear, and movement from consolidation and complete rigidity to one extreme and relatively free but controlled movement at the other. Now, all these movements in between that, there is shearing, stress, then there is little movement in this symphysis pubis, both the symphysis, they articulate. Now, false joints and true joints, continuous bone connection in which intervening tissue consists of fibrous connective tissue, cartilage or bone, no to low to moderate mobility, no mobility or low or moderate mobility. This is false joints. Synarthrosis, sutures and gomphosis. The synarthrosis and sutures, if you see the skull, you will see it is interdigitating with the two bones of your parietal, occipital. You can see the sutures like this. Okay. Now, gomphosis, that is synarthrosis and gomphosis. That's the in the mandible, the bones, the maxilla, where the tooth is held in the cavity. Now, that is known as sutures and gomphosis. Diarthrosis, fibrous, synchondrosis, cartilaginous, symphysis, fibrocartilage, syntosis, bony fusion, atypical cartilaginous joint. Okay. Now, true joints, discontinuous bone, this is continuous bone, connection in which joint cavity is separated by a space. Diarthrosis, criteria, shape and arrangement of articular surface. number of joint accesses, number of degree of freedom. Now, Amphiarthrosis, stiff joints, mobility greatly restricted by strong ligaments, external proximal tibiofibular joint is the example, proximal tibiofibular joint and sacroiliac joint. Okay. There in the leg, if you see the proximal tibiofibular joint is not, you can move even if you feel it like this, but there is a small articular surface, but it is ligaments are there to support the knee joint. Now, classification of joints, structural classification, it is fibrous, cartilaginous and synovial joint. This is structural. Classification of joint is structural classification, fibrous joint, cartilaginous joint and synovial joint. Functional classification, Synarthrosis, Amphiarthrosis and Diarthrosis. Now, development, embryonic condensation of mesenchyme either in the sheath of from cartilaginous template from bone, forms bone. The embryonic condensation of mesenchyme either in sheath or from cartilaginous template from forms bone. Mesenchyme remaining between the developing bone represent primitive joint, interzonal. Determine type of joint that will form, fibrous or cartilaginous or fluid filled cavity. Now, in the embryology, it can be a short note, and also when you are saying describe the joint. Okay. Then you have to be around 16 marks or 20 marks. Now, classification of joints, you see fibrous joints, Synarthrosis, immovable, cartilaginous joint, Amphiarthrosis, slightly movable, synovial joint, Diarthrosis, freely movable. The hip joint, see, you can just move, you can move, you can this, okay. Now, fibrous joint, articulating bones are joined by fibrous tissue, fixed joint with no movement possible, subtypes, sutures, Syndesmosis, Gomphosis. Now you can see the bony sutures here. Here, see, this is an enlarged view of the skull. Sutures, bones are bound together by sharpish fibers. Now there can be a short note on sharpish fibers. Then you have to draw a figure and just say this. See, present in skull bones, this is skull bone, absolutely immovable, fuses at birth, craniosynostosis, craniosynostosis. Now, when you see, go to the dissection hall and see the skull, you cannot move them. This is an adult skull. If I cannot just move like this. I do my eyebrow and then these bones also move. It is not that. Okay. Now, types of sutures, serrate, short tooth appearance of edges, example sagittal. Denticulate, the margins present teeth with tips being bordered, then the roots, example lambdoid. Now, denticulate, the margins present teeth with tips being bordered, then the roots, example lambdoid. Squamous and limbus. Squamous and limbus, edges of the bone united by overlapping. Example, parietal and squamous part of the temporal bone. The temporal bone is here. This is the external auditory meatus of the temporal bone. Now this squamous bone, the edges of the united squamous and limbus, edges of bone united by overlapping, example parietal bone and squamous part of the temporal bone. Yeah. This is the temporal bone. This is parietal bone. This suture. Plain borders united by sutural ligament, example between palatine process and of two maxilla bones. The wedge and groove sutures of Syndialysis. Now Syndesmosis, bones are connected by connective tissue, interosseous membrane. This is the interosseous membrane, this is the radius, this is the ulna of the upper limb, very slight movement. This very slight movement. If you just say you want to hold your hand, now if you want only the ulna to move, you press even it won't move. There is mobility, but very little mobility. Middle radioulnar joint, distal infrotibiofibular joint. This is the medial malleolus, this distal or inferior tibiofibular joint. This. Now, Gomphosis, very nice illustrated here. This is the socket, this is the Gomphosis, root of the tooth, and periodontal ligament. This is the periodontal ligament here. Dental alveolar joint binds the teeth to bony sockets, alveoli in maxilla and mandible. Now, it binds. Now, you have caries tooth. If it is a small caries, then you go for root canal to save the teeth. Okay. But if it is your caries is deep, cannot be this thing, then you have to extract. And also, the amount of this thing, and you fear. You sit in a dental chair, you give the injection in the alveolar nerve, is blocked and kadak. And even if it is so much tough at times, broken, and also then they make an incision between the Now, you need so much power. At times, if the things this is broken, say, this is broken, this is wide off. Okay. Now, what you have to do is that the dentists do, previously general surgeons, like that. They put in to the handles, it has handles. You need an incision to be made. But slowly you just separate the gum and then put the thing and you lift up and suture. So, see, your people are doing some, like a thumbs up bottle you are taking, a cold drinks bottle. Suddenly one guy puts in the thing. So, Tuck. Friends clap, party. Okay. Now, that is so, that it looks in the picture, see here, see the socket here, Gomphosis, this is the, now you just like that, or you take between the, some, nowadays the beer is being sold in cans, beer is being sold in cans, so that is just, you like peel off the skin of a fruit, like that you just open. But now if there is a bottle, then you have to, some friend, when he comes and, I khulbo, crack, he opens up. So it is so much it's a small socket, small tooth, it's not like the opening of the synovial joint of the hip joint. Okay. Now, the movement possible is minimal. Fibrous connection between tooth and socket, periodontal ligament, and movement is possible. See, when you are taking some mutton, okay, haddi, the joints won't move. I have a loose tooth. By aging, you can do. But you people, you can just immediately do just, but that time they don't glide, they don't move. You can glide, you can bring your jaw like that movement of this thing. But the teeth or tooth, whatever it is, they don't move. So I will add it one small story. I was a student of class 5 or 6. My this thing, grandfather used to stay in Hooghly, Shaurafuli. In some holiday, I accompanied him to buy a pair of boots, football boots. So he had a loose tooth. He's saying, see, this tooth is being loose. So what he did, his office was just beyond Howrah Bridge in Brabant Road. What he did, he just stood, crossed the Ganga bridge mid portion. He stood, and Dadu, what are you doing? What do you want to do? Then he said, no, see, I have a loose tooth. Then he just did this and threw it in the Ganga river. So, it's just a break from your boredom. Now, cartilaginous joint, articulating bones. Articulating bones are joined by cartilage, hyaline or fibrous. Articulating bones are joined by cartilage, hyaline or fibrous. Movements possible is more than fibrous joint but less than synovial joint. Now, the difference between a cartilaginous joint and a fibrous joint and a synovial joint. Now, it is movements of possible is more than fibrous joint but less than synovial joint. Subtypes, primary cartilaginous joint, secondary cartilaginous joint. Now you see, primary cartilaginous joint, Synchondrosis. See, bones united by plate of hyaline cartilage here, rib 1. With age, cartilage ossifies temporary joint. This is ossification occurs. Example, first chondrosternal joint, costochondral joint, xiphisternal joint, and spino-occipital joint. See, these joints with age, cartilage ossifies temporary joint. Example, first chondrosternal joint, costochondral joints, xiphisternal joint. See, we have a bone of the sternum where there is xiphoid process, there is a hole and it is joint already. Now, this first costochondral joint and xiphisternal joint, this xiphisternal joint, you ask Avinash, you just see it. You have seen it, but you see it today. Any day you want, we go to the resection hall. Okay, you just see that there's a hole also. Now, secondary cartilaginous joints, symphysis. Symphysis, secondary cartilaginous joint. Symphysis, midline joints. Articular surface united by disc of fibrocartilage. Yeah. Fibrocartilage joint, symphysis pubis. Permanent joint and persists through life. Permanent joint through life. Example, symphysis pubis, manubriosternal joint, intervertebral joint. Yeah. Intervertebral joint. This. Intervertebral disc, cartilage joint. Each disc consists of annulus fibrosis at periphery and nucleus pulposus in the center. Now, you see, this is annulus fibrosis and nucleus pulposus. This is the spinal cord, this is transverse process, this is the spinous process and superior articular facet. Now, intervertebral disc, each disc consists of annulus fibrosus at periphery and nucleus pulposus in the center, And the nucleus, your annulus fibrosis, it's like a ring. It is in the periphery. Okay. Now, acts as a shock absorber, offers resistance to compression and even distribution of compressive forces. Now, it is designed in such a way that two vertebrae are interposed with the intervertebral disc. See, in the acrobats or some or dancers, the acrobats. Now, one person comes and do some motion and he stands like this. Suddenly, one moves and stands on this, making a pyramid with like 3-4 structures and moving around. The top girl moves around. So, all this weight is being distributed. It is equally distributed with the person who's standing the first, holding these people above. So, it is like that. But even you fall from the first floor or thump, you stand like this. Sometimes what happens, the calcaneal injuries comes. There's a fracture of both calcaneum. It can happen. But your the vertebral joints, might be saved. But if you are going in a bike or a high speed head-on collision with in the car with some bigger vehicle in the high road, if your driver puts in and suddenly he hits, that time you might have a disc prolapse. See, intervertebral disc, each disc consists of annulus fibrosus, periphery and nucleus pulposus in the center, acts as a shock absorber, offers resistance to compression and even distribution of compressive force. Disc prolapse can occur. Now you do a plain radiograph or X-ray, AP lateral view of the spine, then you might get some imaging. There will be images there. It can be a normal contour, or you can make, if there is some dislocation or some this prolapse is there. But best is you go for an MRI. For any person who comes and complains with you that he fell down from a height or he collided, then you have to go for an MRI. Then you can see the image and also the disc prolapse, how much it is, it is prolapsed. So, accordingly, the compression is there, then neurological manifestation due to your compression of the prolapsed intervertebral disc, and accordingly you have to give your treatment management. It can be it can be if it's a mild degree, then you go for a traction, medicines, and if doesn't improve, then you have to go for operations. Now, spine surgery is being conducted everywhere, and there is definitely very good results are there. Okay. But the advent of your C-arm X-rays, and during orthopedics operation they can see the image and then accordingly aligned, and also plate screw. Okay. Now each disc consists of, this is repetition, acts as a shock absorber, offers resistance to compression and even distribution of compressive forces, disc prolapse. Now cartilaginous joint, Symphysis pubis. See the pelvis, two pelvic bones. This is sacrum, anteriorly, yeah, Symphysis pubis. Now, the anterior arch of the pelvis composed of pubic bones and their superior rami acts as a tie beam and prevents separation of posterior arch. It acts as a shock absorber. Sometimes it may show presence of sagittal fluid filled cavity. Now, mandibular joint, the body of the sternum makes a pump handle movement. Horizontal cleft may be present, may face Synovial. Symphysis menti, the mandible, Symphysis menti joint. Okay, the mental foramen. When you your head neck you will come across the Symphysis menti, these two mandibles coming, and this is the Symphysis in the midline. Okay. You see, if you ask to pick up the mandible, then you pick up, you describe, then these two parts are separate. So, the Symphysis menti you have to mention, and the mental foramen is here. Nerves are coming out. Atypical cartilaginous joint. Many junctions in body with features of joints do not fit in the classification. Now it can be a short 2 marks question or 4 marks question. Atypical cartilaginous joint. Now atypical cartilaginous joint, many junctions in body with features of joints do not fit in the classification. Bone and cartilage, yeah. This is a cross section of the sagittal section of the skull with the cartilage to cartilage, yeah. This is when you read your respiratory system, it is the, see, this is the hyoid bone. Now, this is the membrane thyroid, your median thyroid ligament, this is and this is you can see this is the larynx, and this is the trachea. Now, you can see cartilage and sutures. Example, nasal, laryngeal, costal, auditory tube and pinna. See, this is your auditory canal. This and this is the small bones of the ear. This is a cartilage here. Now, this is the ear cartilage. Now, synovial joints. Synovial joint, most movable type of joint. The two bones. This is the articular cartilage. This is the joint cavity containing synovial fluid, yellow. Now, articular surface covered with hyaline cartilage, joint surrounded by fibrous capsule lined by synovial membrane. Between articular surfaces, joint is cavity filled with synovial fluid. Knee joint, your hip joint, synovial joint, most evolved and mobile type of joint. Characteristics, see. You can see the pediosteum, the bone, this is the ligaments, this is the joint cavity here, here is the joint cavity, this articular hyaline cartilage, this and joint cavity. Yeah. Fibrous capsule, synovial membrane, this is in green, this articular capsule is here. Characteristics, articular cartilage, cavity filled with synovial fluid, articular capsule, outer fibrous, inner synovial membrane, ligamental support. Now, if you get a short note of synovial joint, 4 marks, you just draw the figure first. Draw cartilage, draw synovial membrane and label it. That finishes. Small notes, just draw this picture. Now, articular disc or menisci, the knee joint, this is, you can see the knee joint, okay. Now, see, the knee joint, this is the patella, this is the lower end of the tibia, this is the upper end of the tibia, this is lower end of femur, the lower end of femur, yeah, femur, articular capsule is there. The menisci are on the tibial upper end. Okay. Now, articular cartilage, in most of the joints are hyaline cartilage except in some fibrocartilage. Yeah, see, beautiful, beautiful picture. This is the lower end of the femur, this is the upper end of the femur. Okay. Now, where resistance, low friction and lubricated, this articular cartilage. Avascular, non-nervous, elastic in nature and inherent slippery. Circumferential dimension. Opposite dimensions are opposite or approximate surface. The two bones are here, like this. Now, this is the lower end of the femur, this is the upper end of the tibia, but if this movement is there, but not because it has to give a ligamental support and the capsular ligament and all that gives you, you're standing like this. See, I am a weightlifter. That whole weight is in the knee joint. Now, if it moves like this, I can move it. But these movements, when weightlifting, but it supports. Okay. Now, wear resistant, low friction and lubricated, avascular, non-nervous, elastic in nature, inherent slippery. Circumferential dimensions are opposite on approximate surface. It is indispensable. Young and old cartilage. Functions: provide smooth gliding surface and reduces forces of compression and weight bearing. Regulation of growth and of epiphysis. Structure and changes. Chondrocytes and collagen fibers from territorial and interterritorial matrix arranged in 3 layers. It can be a question on embryology. Okay. But when you are asked to write a long question on synovial joints, or it can be 10 marks question, then you can mention the chondrocytes and collagen fibers from territorial and interterritorial matrix arranged in 3 layers. Yeah. See, beautiful picture. Zone 1, 2. See, this is the trademark calcified cartilage, subchondral bone. Now, degenerative and proliferative changes occur in cartilage in the advanced stage. Now, degenerative and proliferative changes occur in cartilage and in advanced stage. When as you grow, your initially whatever profession you are, your movement was fast. Okay. Now, when you were in a kid, then you were waddling like this. But as you age, then slowly you are not bothered. Again you start riding and play. Okay. But as you age, you see you get arthritis. Due to degenerative and proliferative changes occurs in cartilage in advanced stage. This is a picture of, see how the cells are working. Now, again, articular capsule consists of outer fibrous layer and inner synovial membrane covering non-articular surface also. See, here is a shoulder joint, picture of shoulder joint consists of outer fibrous layer and inner synovial membrane covering non-articular, and you can move like this. So you can move. So if there is some ligamental injury or not, acromioclavicular ligament, you fall, there might be a fracture, then your joint movement gets restricted. Okay, and it's painful. Now, complete investment with exception synovial protrusions. Yeah, the joint cavity is open, very vascular nervous and maybe have apertures. See, this is the head of the humerus. You can see the granullar cavity here of the scapula. Acromion process is cut, it's cut, and capsule of the shoulder joint is tapered here. Yeah. And muscle of the rotator cuff is cut. It's cut to expose the joint. Now, there can be a question on rotator cuff. What is the rotator cuff? There is another beautiful picture with the thing. All muscles are cut open. So, when you are describing the rotator cuff, you have to give it these points. Capsular ligament, extra or intracapsular tendons. Here, the synovium tendon, your tendon, and this is the pulley. Functions. Secretion of Synovial fluids, liberation of hyaluronic acid and removal of particulate matter. Type fibrous areola adipose. Yeah, this is joint. Synovial fluid, see, it's all being repeated. Now, cross section shoulder joint, acromion, clavicular, bursa is there, coracoid process, capsule. This is the cartilage, yeah. This is the cartilage. This is the upper end of the humerus with capsule with fluid. Now, synovial fluid, low volume, pale yellow, viscous alkaline. Disilate of plasma, which is added with hyaluronic acid. Hyaluronic acid is responsible for viscosity, functions, nutrition, lubrication of cavity and wear and tear, elastic fluid film, weeping, lubrication and boosting effect of lubrication. Environmental temperature divided by viscosity, more movement, more the lubrication. Now, naturally, if you the joint is mostly used. Now the shoulder joint. So if you open it, you can get a large amount of synovial fluid if you syringe it out. Okay. There can be fall, there can be the swollen shoulder, but mostly in the knee, swollen up. Then there can be hematoarthrosis. The joint cavity is filled with blood. It can be from soft tissues and also internal bleeding. Now, now see the ligaments. It may be true or accessory ligaments. It may be intra or extracapsular, intra or extrasynovial. Now, it may be intra or extracapsular, intra or extrasynovial. May show phylogeny, function, permits desirable movement, stability. Now, stability, your hip joint is very stable, synovial joint. Shoulder joint is unstable. It's also a synovial joint, but with greater mobility. Okay. Now, synovial joints, articular disc, menisci, fat, pads and labra. Now, joint cavity sometimes divided by fibrocartilaginous disc into compartments due to low congruence. Now, see your hip joint, it has a head and neck. It goes inside the acetabular cavity, but it is moving more, movement is more. But in the knee joint, it is restricted. It is restricted, but there is mobility. There is also many movements you can do. Okay. Now, division may be complete, jaw joint, sternoclavicular joint and inferior radioulnar joint, or incomplete knee and acromioclavicular joint. Yeah. This is the upper limb, the atlas tibia here, articular joint C, articular disc. Now, lunate, scaphoid, these bones are there, and hamate, capitate. You see the articulated hand and also the articulated foot. You have to know the bones names also, minimum the names, and some important joint that is forming with the wrist joint. What are the bones involved? Now, see, here, this is the disc, condyle, temple bone. Now temporomandibular joint, TMJ. When you temporomandibular joint, when you go and do head neck, you will be taught, and temporomandibular joint, you just for your interest, every book is given. Please look into Gray's anatomy pictures. You take it in the mobile. If it is not in your book you are reading, most and beautifully explained. It's just 2 pages from Gray, not American Gray, but UK Gray, Gray's anatomy. You have a tab, you just download and see. Beautiful, beautiful. Now see the now see functions, lubrication by maintenance of interval, gliding and angular movements, prevention of wear and tear of articular cartilage, synovial fluid is there. Now why articular cartilage differ from typical hyaline cartilage? The difference between hyaline cartilage and articular cartilage. Now articular cartilage is devoid of perichondrium, more avascular, nutrition through synovial fluid, does not regenerate, does not undergo ossification with age. Now, the criteria of classification according to the number of articulating surface. Simple, only 2 bones come in articulation. Example, interphalangeal joints. See, 2 bones, interphalangeal joints. Yeah. This. Now compound, simple and compound. More than 2 articulating surfaces involved and share a common articular capsule. Example, elbow, ankle, radioulnar joint. This. Complex. Joint cavity divided into compartments by articular disc or menisci. Example, knee and sternoclavicular joint. Here. It's a repetition. Anyway, criteria for classification according to the number of articulating surface. Simple, compound, complex. Yeah. According to the axis of the movement. This is very important. Axis. Yeah. Now, you can say uniaxial joint, it has 1 degree of freedom. Example, elbow, ankle and interphalangeal joints. Now, biaxial, it has 2 degree of freedom. Example, radiocarpal, carpophalangeal joints, metacarpophalangeal joints. Polyaxial joint possesses 3 degree of freedom. Morphology called as ball and socket type of joint. Example, shoulder, hip, talocalcaneonavicular joint, talocalcaneonavicular joint, hip joint and your shoulder joint. Now, this is polyaxial. That means it moves in different axes. Okay. Now, biaxial, it has 2 degree of freedom, radiocarpal, metacarpophalangeal joint. Now, you can see here, the body plane, the axis is there. Now, plane synovial joint, articular surface is flat. plane, this permit gliding movements. Example, intercarpal joints, intertarsal joints, joint between articular processes of vertebra. This plane synovial joint, articular surfaces are flat, permit gliding movements. Examples, intercarpal joints, intertarsal joints, joint between articular processes of vertebra. This plane joint. Hinge joint. Articular surfaces are pulley shaped. Yeah. Movements permitted in one plane around transverse axis. This. Examples are elbow joint, ankle joint, knee joint, modified hinge. Knee joint is modified hinge joint. Interphalangeal joints. So, elbow, ankle and your knee joint, but it is modified hinge joint and interphalangeal joints. Now, pivot joint, articular surfaces comprise of central bony pivot surrounded by osteoligamentous ring. Here, this is superior radioulnar joint. Yeah. Osteoligamentous ring. The movements permitted in one plane around vertical axis. Example, superior and inferior radioulnar joint, superior and inferior radioulnar joints. Median atlantoaxial joint, median atlantoaxial joint. Now, condylar joint, see, ovoid articular surfaces, condyle fits into an elliptical cavity, permits movement in two planes, flexion, extension and rotation possible. Flexion, extension and rotation. Okay. Now, you see this. Yeah. This is the occipital bone, axis atlas here. And for example, temporomandibular joint, atlanto-occipital joint, radiohumeral joint. Example, condylar joint, examples, temporomandibular joint. TMJ I told you. Okay. Atlanto-occipital joint here. Okay. Radiohumeral joint. Radiohumeral joint. This is the radius. This is here. Humerus lower end. Now, ellipsoid joint. Convex articular surface fits into concave cavity here. Permits movements in two planes. Flexion, extension and adduction possible. Example, metacarpophalangeal joints and wrist joint. See, you can see the here, ellipsoid joint. Abduction, adduction, this is adduction, this is abduction. This is the index finger, middle finger, ring finger, digits of the hand. This. Now, saddle joint, articular surfaces are reciprocally concave or convex here. Concave and convex here. Now, movements possible in multiple axes. Flexion, extension, adduction, abduction and rotation permitted. Example, first carpometacarpal joint, sternoclavicular joint and calcaneocuboidal joint. Ball and socket joint. Articular surfaces include a globular head fitting into a cup-shaped socket. Movements permitted in multiple axes. Flexion, extension, adduction, abduction, rotation and circumduction possible. Your example, shoulder joint, hip joint, talocalcaneonavicular joint. See, you just go home have the book in front and the movements, what can be the adduction, abduction, flexion, dorsiflexion, plantar flexion, and also moving, rotating. You just hold it like this and rotating. These are all in the your talonavicular joint, hip joint here, shoulder joint. Movements and mechanism, types of movements, gliding or translation. In plane joints, one bone glides over another bone with a limitation. Now, angular movement, the flexion, extension, bending, straightening, or your approximation and deviation of two morphological ventral surfaces. This principle is exception. Abduction and adduction, approximation or deviation apart towards medial plane or midline. Course of reference axis may be different. Circumduction, combination of four angular movement in successive order describing a cone. Movements and mechanism, rotation. Now this movement occurs around a vertical longitudinal axis. This is rotation proper. Rotation proper is a list of two adjuncts and conjunct. Adjunct is due to muscles and conjunct is due to configuration of articular surfaces. Now, additional rotation around transverse axis. Transverse and anterior axis produce flexion, extension, abduction, adduction respectively. Now, movements of the mechanism, factors limiting a range of movement, shape of articulatory bones, tension of ligament, tension of antagonistic muscles, approximation of soft parts, factors maintaining stability of joints, bony configuration, ligaments and muscles. Now, the limitations we see your shoulder joint can go like this, but your hip joint it is restricted. Adduction, abduction. Okay. Now you can move in restricted. That is due to the capsule and the muscle and this is the ligaments. But in shoulder joint, it is quite. If you see both the one picture with the see, this is the scapula, glenoidal cavity. Now, there is a picture of the cross like this section of different muscles which are coming here, interposing here, different. Okay. Similar picture if you see in hip joint. Does it like this? Again, like this, your muscles are there. This like this, and this is the. Now, the two similarities more or less similar. You take a one page, 2 pages, means open your khata, you draw shoulder joint, label it in one page, A4 size. You draw one side the sectional the picture of the shoulder joint and sectional picture of the hip joint and you compare both, label it and compare. It will be easy for you to correlate and also to absorb it in your head. Because see, don't panic in this exam. It's a litmus test. You know what is litmus test? You have a litmus paper, you go to biochemistry, you take a litmus paper, there are some numbers 1, 2, 3, 4, 5, 7. Now, you dip it in acid, you dip it in your alkali lotion, you will see the color changes. So, this is your litmus test. You don't panic, don't bunk. If you have prepared for 10 questions, you give your exam. Paper 1, paper 2, if you get 40, that's great. But by panic you are escaping. You are not facing what is to be done. Then we again next will be your abdomen, lower limb. Then it will be your your skull and neuroanatomy. So you know the pattern of questions, you will be knowing how the paper is set. You are knowing it, you are studying from past 5 years questions you are studying, you are doing your online courses or anything. But I tell you, you have to, after this exam, please 1.5 hours, I take half hours to move from here, but one solid means solid. 1 hour you just spend in your demonstration room and also in your dissection hall. ये अविनाश dissection hall body গুলো কতদিন থাকে রাখা 4 দিন so 4 days the body is there. So when your teacher demonstrate to you in this lecture theatre or that whatever it is, you go back in your histology practicals or you are doing some dissection, demonstration is there. You please try to switch over by groups. See the osteology part which have now the upper limb and your lower limb is finished. So you want to do, but you go with the current osteology. Revise. They will provide you bones and everything for the class. As I have, I give it to your these. So you can access the your hall, dissection hall, and we have enough. You have your bones, personal bones. You carry, or you can get your artificial bones are there. Also, we have a few sets, but you have to indent. Requisition खाता में लेना है. So you can study tab help there. By your key kamna cho, you have half an hour ahead of lunch. The lunch so prepared already. So you go, you are having 1 hour for lunch, 1 to 2. So you move 10 or just 10 minutes prior to 1. When 12:45 you leave. But more than 1 hour, 15 minutes you spend in these two practical rooms. You sit in your groups, 5 friends or something like that, sit, open the book, tab, whatever it is, and you just recapitulate what the teacher taught you or demonstrated to you. I am telling you from the very first day, you do this practice for, and you will definitely get 60% marks. Seeing is believing. You see it. This is the foramen magnum. Now, what structure is passing through the foramen magnum? Now, the skull, it is the foramen in the skull. It's the biggest foramen in the human body. For 10 marks or 6 marks, label the picture, you have to coordinate like this. Every thing in life has a synchronicity. Suddenly you think of something, you are having a practical anatomy class, you are thinking of what biochemistry or physiology in this class. Don't do it. When you are doing physiology, do a physiologist. You become a physiologist. When you want studying anatomy, you become an anatomist. Now, movements and mechanism. Now, see, factors limiting the range of movement, factors maintaining the stability of joint. This I have been repeating in this class. Every joint, what I told you, the same thing I am repeating. You need not have any problem. This can be a short note. Bursa. A bursa is a plural bursa or bursas. Latin bursum in synovialis is a small fluid-filled sac lined by synovial membrane. Now, yeah. Now, with any inner capillary layer of slimy fluid similar to that of an egg white, you see in dieting, what happens? The egg white is, you are putting it in your soup. The only white portion of the egg, the yellow portion you are taking. But I love to take the whole egg. Anyway, just to give you an example that it is the egg white. See, yeah. Sometimes what happens? You have to give some injections, or you have to take out the fluid from the joint cavity. Now you have to times you have to prescribe in osteoarthritis of the thing is that, or you fall down, it's paining for first 10 days, 15 days, or after that 1 month, pain persists, then you give some injection. The orthopedic surgeon and geometric configuration, mechanical axis of bone, movement executed by bone and permitted at joint are necessary for kinesiology, the study of joints. Okay. Now, avoid surface and evaluate of profile, mechanical axis of joints, slide, spin and roll. Now, blood supply. Epiphyseal vessels enter the long bones at or near the attachment of the fibrous capsule and gives articular branches which ultimately break up into a rich capillary plexus in the synovial membrane. This periarterial plexus or circulus or vasculus, arteriovenous anastomosis may exist. Now, this you have every joint you study, you see a beautiful picture of the vascular supply. And a unique picture is you see of the knee joint, the vascular supply of the knee joint. You can see the both in the knee joint, both the bones, and then any book you are studying, you get the picture. Okay. Nerve supply of joints, articular capsule and ligaments possess rich nerve supply. It contains sensory and autonomic fibers. Nerve supply of joint, articular capsule and ligament possesses rich nerve supply. It contains sensory and autonomic fibers. Sensation conveyed are proprioceptive reflexes, control of posture, locomotion and perception, position and movement. Now, this you have read in your physiology. You have read, they taught you physiology. This portion, sensation conveyed in proprioceptive, reflex control of posture, locomotion and perception of position and movement. Free nerve endings may convey pain sensation from fibrous capsules. Hilton's law, Gardner's observation, applied anatomy, dislocation and subluxation. You can see sprain, arthritis, rheumatic fever and rheumatoid arthritis, osteoarthritis. See osteoarthritis, wrist, septic arthritis, fracture of joint space, stiffness, neuropathic joint.